away for my follow-up appointment. Hopefully that'll go well. At the end of this video, I'm going to show you what they gave me at the hospital, different positions I tried, and what I ended up doing. So stay tuned for that, and the results of my follow-up visit. So my vision's been kind of trippy, so and my eyes still pretty red, but actually it kind of looks worse today. I don't know, but we'll see what they say. Yeah, I mean, I don't have any eye pain or anything like that. It's just red, and I see kind of stuff that we can talk about later a bit. So but yeah, stay tuned for all that. All right, so that was great news. I told him it was difficult not knowing what to expect. So he said some patients do look at social media to see what to expect. I didn't do that going into it or after. So one thing I described is I see like little dry flecks of blood, probably dry blood. You know, if it was wet blood, it would be like pouring dye into water. But they're dry. They're little specks of dry blood or debridement, whatever, that didn't get sucked up by the little vacuum cleaner, but that's okay. Things are healing. I have no hole. That has taken very well. He mentioned when I was talking about the, like, seeing the blood specks and stuff, it's almost like a hologram or 3D thing, and they look like they're floating about here when I see them, and they change like from day to day. One may have one kind of design, and then the next day it's like that broke up a little bit, so now I have two bigger specks and some little pinhole specks. It's been really trippy. And then the other thing that's interesting is you end up with, you know, that picture of the earth. You see the earth kind of concaved, and then you see the space in the background. It's kind of like that, but in your eye. So like if I look just my eye, I can see this finger up above here. But once I get like into the hand area, I have a black line that goes across, kind of like the earth. And then below that, it's all totally blurry. So, but what I noticed today is that had decreased quite a bit compared to even yesterday. So all of that is normal, absolutely normal. And what he said that is, it is the gas bubble that they put in your eye. So, and he said eventually as that nitrous oxide bubble dissipates, it'll get better. So he said, you know, continue to have my head regular, however I want to move it during the day, but at night try and lay on the side or face down. So I've never gone face down really, except for head down, like really far down, except for that recovery time in the hospital. The nurses made me do that, but then once I saw him for my after surgery appointment, like immediately after surgery, he said, yeah, you can just put your head down, but this is not medical advice. You got to talk to your doctor about your particular surgery, because if it was worse, he may want you, or she may want you to put your head down further or whatever. But he said I'm healing very well, and he kind of seemed shocked, didn't he?
Surprised a little bit.
Yeah, a little bit surprised that I was healing so quickly. But I've been very diligent about, you know, putting my eye drops in. I've only had to use an ointment like twice. And so, yeah, everything is great. And I'm excited. So I have another follow-up appointment in a month. And, yeah, so I'm really thrilled. I can wash my hair now. He said still don't get, you know, try not to get water in that eye. Had I thought about it, I probably would have gotten some of that press and seal that you use in the kitchen. It's great if you have stitches, broken arms, or casts or whatever. I've used it for to cover up wounds and stuff that shouldn't get wet when I've had a medical procedure, and it works pretty darn good. I don't recommend it. Again, this is not medical advice. You do create a risk when you use it, but I've been pretty lucky so far. But if I'd had that, I don't know if I could just stick it to my face and it would work. That'd be questionable. So I've just been using a washcloth to wash my face, and then I'll do a full shower, or not a full shower, but wash my body and everything in the shower. So that's how I've been avoiding anything with my eye while keeping very nice and clean. What else is there to tell? I mean, it's just, again, if you think something's worse than it is, then definitely just don't take, it's cataracts, it's going to be bad. And my vision actually now is 20/25, so it's very close to being really good. And I don't know, I'm just so glad I had it done, because even what I can see now, it's way better than what I saw pre-surgery. So hopefully I'll just be on this healing journey now. I still have to take it easy. I can't lift anything over 10 pounds for another week. Then I can graduate to 20-30 pounds for the next,
there's a speed trap ahead.
I think, month or so after that, until I see him again, basically. And then, still I got to watch dust, that type of thing. So what I've been doing, the couple times I've been outside, I'll just put a napkin over my eye, fold it in a quarter, put that in over my eye, and then put my glasses on. And I've been wearing sunglasses because I'm very sensitive to light. So sorry about the distance on the camera. But anyway, I was relieved, because I told Chris even this morning, I'm like, I may not want to eat in case I have to do a surgery again. I was really nervous. And there are a couple medicines I had to go off of for this surgery. But I'm going to start those again here soon. I don't know if I'm going to do it today, maybe the weekend. We'll see. But yeah, I am just so pleased. Now they say expect the cataracts to escalate kind of quickly. So, and the other thing I have is macular degeneration, which you can't really do anything about, but keep on top of and eat all the good beta-carotene vegetables, and antioxidant type stuff is good too. But mainly the beta-carotene heavy foods, which is part of my diet. I eat a lot of tomatoes. Basil is really high in beta-carotene. I eat a lot of that. Carrots, I love. So lettuce, leafy greens, I eat all that. And yet here I am. But what the guy told me today, not the doctor, but one of the techs, he said it will slow it down. So you're better, and they want you to eat the food, not the vitamins. But I am taking the supplement as well, which they do recommend. But yeah, if you can eat really healthy foods, that's the way to go for sure. Anyway, so if you have any questions, I'm going to finish this out though when I get home, in showing you the positions that I tried and what worked best for me, and what devices I used. They gave me a pillow out of the hospital. It wasn't that great for me. So I'll show you what I came up with instead. So just hang tight and we'll be right back. And another thing the doctor said, he said a lot of the patients that he has that grew up in the 60s really loved the surgery, because they said it kind of brought flashbacks. Like I said, you see these trippy things, like during the surgery you see the wash and it swirls around and everything, but then like this hologram effect of these little like dried blood spots like hanging out in space. Your depth perception is way off during the surgery, or post-surgery. It will get better, but yeah, that is really, really trippy. And then having that elliptical thing that, you know, settles down from the nitrous oxide air bubble, that's really trippy too. But the more I keep my head down or sleeping on my side, which I'm a side sleeper anyway, that really helps. So he said continue, you know, sleeping on your side, or if you can on your stomach, which I can't. He said go ahead and continue doing that. So luckily I am a side sleeper that does not move often once I go to sleep. So I roll over so Chris can put my eye drops in the morning before he goes to work, and that's it. And then I'm on my own after that. So sometimes it takes me 2 or 3 drops. He said, actually we were running low, I guess, on the prednisone, right, Chris?
I think so.
No, he said on me, he said, I guess because I'm healing so well, he said, look, if you run out before the time is up, don't worry about it. He said, you're healing great. You know, you shouldn't have to worry about anything if you run out. So trying to be conservative, but it's hard putting these drops in by yourself. So if there's someone who can help you do that, I highly recommend them. And it's 4 times a day, but they'll make you get up in the middle of the night. What was it? 8 and 4? 8 and 4.
8, 12, 4, 8.
8, 12.
Then 4 p.m. Then 8 p.m.
8, 12, 4, 8. Yes. So you don't get up in the middle of the night to do it every 12 hours. But yeah. Anyway, that's it. And like I said, stay tuned, and I'll show you some positioning once I get home. Here are the many positions I went through. Well, not too many, but some of the positions I went through well, immediately after surgery. So they give you this in the hospital, and I guess the idea is to put your face here or here, and then put your nose down in between here, kind of, but it really doesn't fit, and you don't want to put any pressure on your eye. So it was okay, like coming home, but I also took a giant European pillow with me in the car, and I took a regular standard pillow with me in the car. And I'm so glad I did, because I was able to kind of bunch those up. And I probably would have been better off with 2 Euro pillows, but because the little one kind of just slipped down. And this is what I really needed to really comfortably. I think I did it this way and kind of leaned over in the car like this. So, but then once I got home, it was finding a place to get comfortable. I only had 2 hours sleep before the surgery. So anyway, we came back here to the guest room, which, you know, I need to make the bed. I need to do a little bit of cleanup here. So I came here and I tried this here. And what happened was my nose started clogging up and I couldn't breathe. And then I was miserable. I was tired. I was not feeling well. So, I mean, I tried this multiple ways. I think I took this pillow here and put it here like this. And then we also this is an adjustable bed. So we adjusted the leg to come up so I wouldn't have to bend over so far. So we tried things, believe me. And then none of that made me happy, I think. And then, did you get this? So then I remembered we had this neck pillow. So I had Chris get the neck pillow. And then we did, this is way, way better than that. So, and make sure it's filled up all the way. It still wasn't quite comfortable. And by this time, I think it was like 3 hours post-surgery, my neck and my back were killing me. So, oh, and I made sure I had a chair that had arms on the side. So if I did go to sleep, I wasn't as big of a fall risk. But Chris also got a chair and sat here with me to get me comfortable. And again, because this is adjustable, we when I wasn't comfortable there, then we came over here and adjusted the bed which I'm not even going to do. But I tried the bed straight up and then just kind of sitting there with my neck down. I couldn't get comfortable there either. So then we'll continue on to where I moved to next. Okay, so this is where I ended up on the sofa. This is also where I lived for, I don't know, about 3 or 4 months after a car wreck. So I put the pillow, we have a high side sofa, which is nice. And then again with the Euro pillow came here. And then I put a king pillow this way and one here. And again, because I had to keep my head down the entire time. These are great, but then it's this that really saved the day because it gives me a little bit more cushion. So basically, this is how I slept the first night and afternoon after coming home from surgery. So I was able to keep my head down and keep that gas bubble pulling my eye back. So that's what I did. Now, doctors require different things. So I think it depends on how much gas they use, how severe your macular hole is, and the repair. But for my doctor and for me, this was feasible. Now he did say if you want to put your head down, even today he said if you could sleep face down or on your side. But he was like, oh, if you just want to put your head down to the chin, that's fine. But that may not be all doctors. I've heard a lot of people have had to be face down. In which case, a lot of people recommended a massage table. So you can find those used on Craigslist or from a friend. Now, want to see what my eye looks like? So this is 1 week post-surgery. See if you can get in there and focus. And that is natural. So that's normal. The doctor was very pleased with that. I know it looks weird, but just, I don't want you to be afraid because I didn't know anything going into this. And so, I mean, I didn't, I wanted a beer earlier, but I didn't have a beer. I just now had a beer because he's like, yeah, you're good. So I've been craving one. And so I did have a beer. And, you know, I ate light today in case I had to do surgery again. I didn't know. I didn't know how I was healing, how I was progressing. So I hope this helps someone else feel comfortable with the surgery. Kind of give you a hint at what's okay, kind of what to expect. I'm telling you that the little hologram dried blood spots are really trippy. And I've never done acid. So it's very odd. And then we just had some bugs in here. They're called sewer flies or whatever, but they'll come in through the tub sometimes if you have a septic. And I guess because all the rain we had, they're coming out. But trying to hit one of those, and you're seeing these little splotches, like you don't know what you're hitting sometimes. So anyway, it is a trip, believe me. But anyway, so I hope this does help someone and alleviate fears. The surgery was way easier than LASIK's. The hardest part was the pain in my neck, but I could take Tylenol for that, and that alleviated it for a while. Chris gave me some massages using this neck pillow as a prop for everything to keep it down. I mean, there are a lot of options here. So I really recommend this neck pillow, even if you have to go like here, if you have to go face down, you know, on a table like this, it's a lot more comfortable. And you can see I can get over the edge here. And so I'm able to breathe a lot easier. But any pillow they're probably going to give you in the hospital, these are way better. So take care. Thanks for watching, and we'll see you later. Bye.